So we know that the blacks will have a myeloma 4 years younger than Caucasians. So the usual age of myeloma is diagnosed as about 73, 74. So blacks will be usually diagnosed in their 60s and 70s. Black patients are more likely to to present with worse anemia, high calcium, or kidney damage than whites, and have a higher lactate dehydrogenase, which isn't a cholesterol test. Lactate dehydrogenase is a chemical released when cells are rapidly dividing in the body, saying that the myeloma is growing. Black patients are less likely to have the bone disease because black people naturally have a higher bone density and therefore
Mhm.
less likely to have bone breaks, but still can have bone involvement by myeloma. Blacks also tend to have a particular mutation with myeloma called 1114, where the 11th chromosome and 14th chromosome are stuck to each other, and that makes a bit of a different animal of myeloma, where it is a target of a new drug, and one of our best new drugs for myeloma called venetoclax, which is why we have to make sure that we have adequate representation on clinical trials so that
Mhm.
we know that this drug will work for everybody. Blacks are less likely. The good news is that blacks are less likely to have mutations in the 17th chromosome or deletion of the 17th chromosome or changes in the first chromosome. The reason that's important is that high risk myeloma is very, very difficult to treat. And blacks are less likely to have those mutations than whites. And there's been actually quite a bit of data that, with all things being equal, in clinical trials, the VA system, when everything is equal, the African Americans have at least as good, if not better, survival with multiple myeloma.